Hi. So our today's topic, for everyone who is joining in now, I can see only 5, 7, 10, it's increasing, okay. To everyone, I am Dr. Poonam Sambhaji from Goa, child and newborn specialist from an area called Porvorim, okay. And our today's talk will be on COVID season and how do you take care of your children. So basically a child care during this COVID season. So before I start getting questions, because it will take some time for me to get the questions from the viewers, let me start with the topic, because at the end of this lecture, I know, good afternoon, Ashwin Francis Norona, hi Rajesh Radhakrishnan, hello, okay. So before I start getting questions from you all, I will start some basic things that are required, and I've already made a list, because these are the minimum questions, the commonest questions that I get from all my patients, okay. So this is what I have got over the last 2 weeks that I have been doing regularly live talks. So hi Murli Narendra, hi Praveen Kumar, okay. So and hi to everyone else who is online with me now presently. It's raining heavy here, a pleasant environment. I hope it's the same everywhere else, whoever is joining me. So let's see how do we protect our kids. Now in this session, I'll be telling you different things like, you know, a bigger kid, a smaller newborn, a small baby, baby immunization, so many other things which are commonest problems with the parents. So let's start about a normal child who is around 3, 4, 5 years and above, who understands your communication, so who can follow your communication. I don't think so we should go much into the virus, because I think enough is known about this novel coronavirus. You know why it is called novel? Novel because it is something new which is still being studied, okay. And we already know it came from Wuhan and now it is everywhere, yahan wahan, okay, everywhere over world it is there, and we are battling with it. So now we should know how we can protect ourselves. Basic thing is the public awareness, and not only public awareness, there is no point in we doing public awareness if the public is not following that awareness. So once we give you the awareness, it is very, very important that you follow the awareness points. Now what are the points, and in case of children, how can you protect these children who are like 3 years and above and can follow your orders, okay. So in this case, the children should be taught hand washing, the proper hand washing. Now proper hand washing is around 40 to 60 seconds, that is what we say in adults, okay. But in kids you can keep it to minimum of 20 seconds, because you know they'll get bored just doing these steps every now and then they will say no, I don't want to, chal ja, okay. So best is keep them, restrict them to 20 seconds. So 20 seconds of anything, maybe your hand rub or the soap. You should teach them that you have to first wet your hand, then put little bit drop of that soap if you are using soap, and then start washing their hands with all the steps. So you have to cover them. After the soap is there, you have to tell them wash the hands this way, hateli, okay, then the back side of the both the hands. This step should be shown to them, okay. Then all your knuckles, okay, then the tips of the fingers, so it will be both the sides, tips of the finger. Then this is the part which is most important and missed. So this part, okay, and then the wrists. So you should start teaching them. Maybe at first they will just do this. Appreciate them. Appreciate and say, wow, you've done this. Now do the next step. Do the next step. So it shouldn't be like, no, it's theek se haath dhona hai. You have to tell them, no, you are going to do it this way. Other thing is, now that we have done with the hand wash. The second one is the mask, wearing of mask, okay. Now children below 8 to 10 years, we do not expect them to wear mask continuously. First and foremost, you should not take them out. Whenever you take them out, see the children above 8 to 9 years who listen to orders, wear their mask. Yes, Pritesh Gaukar, thank you. Yes, that means I am clear, okay. So more than 8 to 10 years, see that they wear mask, and the mask should be covering their nose and the mouth, okay. Not that the mask has to be below the nose or below the mouth, only hanging in the neck as a necklace. No, we require the two portals, that is the two openings, the nose and the mouth. आपका नाक और आपका मुंह दोनों ही बंद होना चाहिए विद द मास्क, ओके. और मास्क ठीक से पहनना चाहिए, ताकि अगर आपका मास्क हो ऐसे, और बहुत लोग मुझे पूछते हैं कि कौन सा मास्क डाले. सो यू कैन वेयर कॉटन मास्क, जो कपड़े का मास्क होता है ना, दैट इज ऑल्सो वेरी वेरी गुड, एंड दोज कैन बी, आई एम जस्ट ट्राइंग टू show you one of the cloth mask, 1 minute. Yes. So the cloth masks which are of this sort with the side bands, okay, teach the children that they have to wear this, hold these side bands and not hold the mask in between. So I will show the correct method first. So hold the side bands, put it on your nose, put it on your mouth, and then put it on your ears. Okay, this is the way you are supposed to teach them. Usually what child will do, it will hold like this, then it will do these and then try to put it this way and then spread it on the mouth. So it should not be done like that. Okay, so first is teach them how to hold these bands, and in children preferably do it with the bands. Okay, the mask with the bands. The plain cloth mask will also do. Now below 8 years or like 5 years, why we usually do not encourage mask is because the children usually try to put their fingers in the mouth and the mask goes in the mouth, so all the saliva is touching it. Okay, so the mask becomes wet. A wet mask is not at all a good protection against COVID. Okay, these are because there are mouth secretions, that's a body fluid. If it is infected, then it is going to spread further. That's why in smaller children we do not recommend wearing mask continuously. But yes, in my clinic I do advise parents that when they come inside my clinic to wear the mask for the timing before they go. Like it's hardly 5 to 10 minutes that the child is wearing mask, and then they go out of the clinic and they remove the mask, because out and out they are in their car over there. Okay, so that's about the masks. Second, you have to teach them the importance of 6 feet distance or 2-meter distance. So teach them that if they take around 3 steps, broad steps, okay, then it is going to be around 6 feet to 2 meters. So they have to stand that far from each other. Teach them this, because you know what happens is when they meet someone who is not known to them or who comes and visits them after a long time, then you can tell them always maintain a distance. So the child should be able to say, no, I am going to maintain a distance. Okay, because once they learn it the correct way, they will always go on doing it. Okay, so JK Lakshmanan has asked me, doctor, is cloth mask okay for babies? Yes, cloth mask is okay, but I would prefer you buy a cloth mask with this double layer. So you can see this, it's a double layer mask. Okay, don't use this thin patla, you know, cloth mask through which even the lip shape of yours is seen through. No, do not use those masks. Use cotton masks which are double layer. That would be a better protection. And yes, washing the mask is very important. Daily wash the mask and iron the mask if possible with hot iron. Okay. Then next is no social gatherings. Please do not take the kids for social gatherings. I have seen so many posts, you know, asking for social birthday parties, like, you know, wherein the parents want to give a birthday party wherein the social distancing will be followed. I really do not know what is this social distancing. Can't we do without one birthday party in this year? Maybe it may be your first birthday, sometimes the 6 months birthday which is coming up, the second, third or fourth, fifth birthday. You can have a birthday later on, but this year try to have the birthday at home with a small cake. Okay, that's it. You need not even have a cake. Enjoy it the way, you know, the best enjoyment we are getting now is a quality time with the family, which we never used to get earlier. Okay, there is such a yes, JK Lakshmanan, thanks. Okay, so there is such a good quality time that we can spend with the family, which used to otherwise not get. Enjoy it. You will not get this in your lifetime. After many years we are getting this chance to spend a quality time with the kids. Okay, then that is about the no social gatherings. Then teach them about good health, good food, no junk food, fresh fruits to be taken. Okay, and very, very important is keeping the child hydrated. Though they are in house now, they are indoors now, the hydration has to be maximum, because even in the house you will see that your children are roaming around, running around everywhere. They are not sitting in one place, right? So teach them the importance of hydration. Teach them that every 1 to 2 hours they should sip 1 glass of water or half a glass of water, depending upon whatever is the age of the baby. If a smaller baby, then go on offering more and more fresh water, fresh fruit juices, something like milk or buttermilk or chanch, whatever you want to give. Rice water, dal water, the tender coconut water, so many things can be given for hydration. Now this is about how to protect the kids. So I have completed about the hand wash, the mask, the 6 feet distance, no social gatherings, and the good health of the baby. Okay, hi Vijay Kumar, hi Amol Ghatge and Swapnil Zadav. Coming to the next commonest asked question, okay, is the immunization in babies. Many children have lost their immunization doses now, or the parents have not come to take the immunization doses out of scare that baby may catch corona in the bargain of getting the in the vaccine. Okay, so there is no need of getting scared. In your vaccines, please go and take that. Okay, because corona is already one devil with which we are trying to fight. Okay, now imagine the other devils like the vaccination, the diseases against which we are giving the vaccination. These are the other devils, okay, like the diphtheria, pertussis, tetanus, H influenza B, hepatitis B, pneumonia, rotaviral diseases, measles, mumps, rubella, hepatitis A, Japanese encephalitis, meningococcal, you name them and they are there. Okay, they are there waiting to fight. They are there waiting to attack. Okay, and if we do not immunize our babies with these vaccines, we are going to have another dreaded evil coming and fighting with our kids, okay, trying to damage their health, which we do not want. Over so many years, we have managed to fight these diseases and get them in control. Because of this coronavirus, there has been a lot of delay in the vaccinations, and we are scared these diseases may pop up, okay, and it is going to harm our country, our world at large. So see that you go get your vaccines. There is no harm in going and getting your vaccines.